Hello, everybody. Welcome to March's 2023 Food Thinkers. It's lovely to see you all here. Welcome into the webinar. I can see people are arriving. There's a rapid number who are coming in as we speak. Welcome. Let's get your audios calibrated and get yourself settled down. Welcome again to March 2023 Food Thinkers. I can see there's lots of people still coming into the webinar, so we'll wait a few moments to begin. My name is Dr. Christian Reynolds from the Centre for Food Policy, and I'll be the host for tonight's webinar. But welcome in, everybody. It is lovely to see so many of you here tonight for this webinar. Right, well, we have quite a number still streaming in, but I think let's get underway in terms of introducing our guest to the rest of you. So just a reminder that this is the Food Thinkers webinar series, and our Food Thinkers series is a seminar series that brings together some big ideas from women in academia, policy, business and advocacy on redesigning food systems and thinking about the big challenges within food systems. And tonight we have Professor of Food Policy and Deputy Director of the Centre for Food Policy at City University of London, Christina Vogel. And she's grappling with an amazing topic here, which is implementing equitable and effective food policy. What more needs to be done? Now, while you're all just settling in here, I'm going to be having some housekeeping and notices just to make sure that everybody is settled and has their beverage of choice ready to listen to the webinar. So, firstly, if you would like to receive our monthly newsletter and be the first to hear about future Food Thinkers webinars, please sign up to our mailing list. There's going to be a link appearing in your chat right now. Hopefully, it will take a few seconds. There we go. The time delay magic is working. Next, I just want to highlight that the applications are open to join the Masters in Food Policy that City University runs. So we're starting our new cohort in autumn, and the applications are now open to join this MSc in Food Policy. We have a few more open evenings, both in person and online. So if you have questions, please engage with the staff from the Centre for Food Policy. There's going to be a link to the programme page also appearing in the chat box now. I'll also highlight that if a MSc in food policy is too much of a commitment for yourself, we also offer the first two modules of our MSc in food policy as continuing professional development courses. And this is available, just like our masters, both in person in London, as well as distance or online delivery of these. So you can be anywhere on the planet and get a high-class education in food policy and food systems thinking. I'll also highlight that this webinar is being recorded and being made available afterwards via our YouTube channel. And if you're not already subscribed to our YouTube channel, I thoroughly recommend you go to YouTube, search for Food Thinkers, or maybe the link will appear in the chat below, and subscribe. We have now over 7 years of Food Thinkers talks archived there, and it's amazing to see just some of the different topics covered and so much insight into how we can change the food system for the better. I'll also highlight as chair that we ask you if you could be writing your questions into the questions and answer box. I will be reading these out to Christina after the talk, and we'll try to respond to all the questions you have if we have time available. Likewise, if you'd like to tweet about the talk or live tweet, please use the hashtag #FoodThinkers with capitalized F and capitalized T and the handle @FoodPolicyCity. I think a version of the handle might also be appearing in the chat as well, just so you can see an example. This way we can curate these afterwards as well. Please also do follow us on Twitter @FoodPolicyCity. We try and keep an active Twitter profile going there. I'll also highlight that our next Food Thinkers will be on the 9th of May with Cynthia Rosenweek. But before that, we will be hosting our first in-person City Food Symposium on the 27th of April 2023. And I need to stress how excited we all are here at the Centre for Food Policy to host and hopefully invite you all to come in person to the Centre for Food Policy in City University on the 27th of April. This is our first in-person event since 2019. This year's event is themed Co-Benefits for a Time of Crisis, finding positive food policy solutions to multiple food system challenges. Again, a link to the registration page is appearing in the chat box as I speak. We have an amazing lineup of speakers, and the entire team at the Centre for Food Policy has been working to support and grow this program. It's going to be announced imminently. Please do go and sign up to attend this, and we all look forward to seeing you there. Now, again, this is the March Food Thinkers, and tonight we'll have Professor Christina Vogel come and talk to us. Now, as well as being a Deputy Director of the Centre for Food Policy, Christina is a registered nutritionist, and she's worked in public health nutrition for more than 20 years in Australia and throughout Europe. Christina leads a program of research dedicated to improving population health and reducing inequalities through food policy and nutrition-based initiatives, and leads major research grants from NIHR PHR, NIHR PRP, as well as the Wellcome Trust. Christina has given evidence to the House of Lords Select Committee on Food, Poverty, Health and the Environment, and she is the lead author of Chapter 2 of the WHO European Regions Report on Obesity. And Chapter 2, Obesity Across the Life Course, is an amazing read. I encourage all of you to go and read the WHO European Regions Report on Obesity. It's some amazing reading and some amazing insights there. Christina's work has received national and international press coverage, and again, she is deputy editor of the scientific journal Public Health Nutrition. So I'm looking forward to welcoming Christina to talk tonight at our Food Thinkers. And so without any further ado, please, Christina, share your slides and take it away.
Wonderful. Thank you very much for that introduction, Christian. Right. Are you able to see my slides?
I can. They look brilliant.
Excellent. Fantastic. So thank you all. Thank you for joining this evening. I'm really delighted to be delivering this Food Thinkers for March. Being a new member of the Centre for Food Policy, it's a real highlight to have been asked to deliver tonight's session. So thank you all for joining online, and those who join in the catch-up as well. So tonight, as Christian said, I will be discussing implementing equitable and effective food policy and what more needs to be done. And I think that we could potentially do more as academics and advocates of equity to be doing more. So let's talk about that now. To get started, I wanted to there we go. Start with a quote from an economist who I, like many others, admire greatly, really because he believes that economic policies approaches really should promote equitable distribution of wealth, and that's really closely aligned with how I think I can approach and my approaches for food policy. So this particular quote from Ha-Joon Chang says, "Equity of opportunity is not enough. When some people have to run a 100-meter race with sandbags on their legs, the fact that no one is allowed to have a head start does not make the race fair. Equity of opportunity is absolutely necessary, but is not sufficient in building a genuine, fair and efficient society." And I used to believe, as I said, I really think that this applies to food policy and to implementation of food policy in particular, and that it's not always equally implemented and therefore doesn't have equitable impact or optimal impact as well on all sectors of society. I guess I used to believe that a suite of structural policies would be largely sufficient to address inequalities in diet. But in the short time that I've been at the very vibrant Centre for Food Policy, and on the back of working very closely with colleagues in Southampton, it's really become considerably apparent to me that actually it's conditions and context in which food policies are implemented that really does make them more likely to be equitable and effective for all. I guess to take you and tell you a little bit about me, my interest in addressing inequalities in diet came from particularly thinking about structural policies to address diet. Really came from my time, my very first job out of university, and I finished dietetics and nutrition and a bachelor degree in psychology, and I went and lived in far North Australia. In here, you can see where the yellow dot is, the Gove Peninsula. And there I got to go to this beautiful place for about 2 years. I worked with some absolutely incredible people, some of whom you can see here on the slide. But what became very apparent for me working as a public health nutritionist in very remote Indigenous communities in Australia was just the context and the conditions in which families were trying to feed themselves well were absolutely challenging. And, you know, there's a 14-year life expectancy difference between Indigenous Australians and white Australians in remote Indigenous communities, and really the context and conditions in which people are facing, particularly around diet, are huge. Lack of cooking facilities, lack of access and affordability of healthy foods. One of the key things that I remember is that in many of the remote communities, foods would only be dropped off once a month, and that this really wasn't fair nor equitable. Then I moved to the UK, and the conditions, the situation is not quite as stark as it is for remote Indigenous Australians, but it's very stark and it's unfair that the life expectancy between males and males and females that are living in the most disadvantaged communities in England have nearly an 8-year life expectancy different compared to those who are living in the more advantaged areas. And I know many of us are aware of this, but I think it's nice to be reminded of just how important it is that we continue to ensure that there is equitable implementation of food policies. And that is really because the increase in inequalities is continuing. So we know that obesity is and poor diet is a key contributor to inequalities and life expectancy. And this slide is just a reminder that those inequalities in childhood obesity are continuing. And this shows the increase in inequalities of children aged 11 years over the last 10 years or a little while ago. Taking now some information from Southampton. This is from the Southampton Women's Survey, and really it shows that dietary inequalities start very early in life. And again, here you can see at the bottom left-hand corner that there's less healthy infants and mothers have very unhealthy diet, but the correlation here is stark, where in the top right-hand corner, mothers and children have much better quality of diet. So it's just to say that there's a really stark inequality that starts early in life, but that this is not the fault of parents or children. Here you can see here that to say that inequalities start even before birth, prior to conception. And really this is adopting a life course approach and shows that those difference in inequalities, you've got the red line there where an individual who just happens to be born into a context and condition where they have a higher trajectory for poor diet and for increasing body weight over time. And this is largely because of repeated exposure to conditions and contexts that do not facilitate them to adopt healthy dietary practices, some of which are here. And what is interesting is by the time you get to adulthood and that difference in trajectory is increasing, so increasing weight over the life course, by the time women and men get to adulthood, then that goes back to the preconception. And really, this means that individuals are set up from a preconception environment, then born into a more disadvantaged context, which really leads to an intergenerational cycle of diet and weight inequalities. And again, this is from not only physical environments, but financial environments, social environments, and also psychological environments. And really that much more can be done to address these, and it's structural policies that are required. But as I said, it's the conditions and the context in which they are developed that we really need to start to pay more attention to. It's really pleasing to see that food policies in the UK are moving away from a dependency on information giving, and that there is increasing recognition that information is not sufficient to combat the multiple and complex conditions and contexts in which many families experiencing disadvantage find themselves. And that we're moving much more towards a suite of structural policies that address many of these structural contextual factors. So we've got a few examples here, the recent placement into regulation that was introduced, a post note that really does highlight how important contexts are and structural policies are, the Healthy Start policy, and of course the soft drinks levy. So these policies are excellent, and we need to be advocating and building the evidence and the case for government to act further and stronger and harder. And of course, that is never more apparent than with the delay in the advertising bans and even in the price promotion ban last year. So we absolutely want to be continuing to advocate for structural food policies. However, the context in which those food policies are being delivered, we think needs a bit more of a sharper lens. And I'll give a nice example from the work that Jean Adams and her team have done from Cambridge, which was evaluating the soft drinks levy in the UK. And really, this is quite interesting and insightful in terms of impact and potential contextual barriers that face implementation of food policies. So here on the left, you've got girls who are aged 11 years. The very left graph is the most deprived, and the graph on the right to the left-hand side is least deprived. And what you can really see here is that red line was the projected obesity levels had there been no intervention, and the blue line was actual obesity levels. You've got the first dotted line here on the left is 2016, and that's when the sugar tax was first announced. And what it really shows here is that actually there was a reduction in obesity levels when the sugar levy was announced, and that's excellent. And that actually shows that there's a reduction in inequalities amongst girls. However, if you look towards the right, you'll see that there's not the same reduction in inequalities amongst boys. And Jean and the team give some reasons for this, and of course, contextually, this needs to be explored a little bit further. What is it about boys? What is it about the environments in which this tax is being implemented that could help to promote an equitable impact? So next, I'm just going to talk you through this evening how we might think about that. This is quite embryonic for me as well, so I look forward to a bit of discussion in the chat, in the Q&A later on. But really, I've been starting to think about this much more clearly and how we might go about it, and leaning on implementation science that has been doing this work for a long time, particularly for health service delivery context. But what's interesting when you start to look at the frameworks and look at the evidence from implementation science, much of it considers evaluation of implementation after implementation has occurred. And if many of the food and nutrition policies that were reviewed here in the article on the left really describe, again, that they are more organizational food policies. But what's one thing that's quite interesting is equity is very rarely considered as terms of an important component of implementation, and also that few had taken a systems approach. So I think there is much more to be done in this area, and look forward to seeing how we can progress this going forward. One of the things that we have been very good at doing recently is thinking about the systems mapping. And this is really helpful in terms of the context and conditions in which food policies are being implemented. However, it's quite causal focused and focused on pathways and interactions between components, and doesn't provide great detail into specific contexts of people's lives or of those that are implementing a food policy or enforcing a food policy. So I think it does pave the way for further work in terms of implementation. Tonight, I'm just going to talk through two examples that are quite close to the program of work that I do. As Christian outlined, much of my work is around retail food environments, and I've been working over a number of years with some great colleagues around these environments. So I'm going to draw some examples around why I think we need a sharper lens on the conditions and contexts in which food policies are implemented from the body of work that I've been leading. So first of all, I'm going to focus on the recent food promotion and placement legislation that was introduced in England on the 1st of October last year. I just wanted to say a little bit about why I've been interested in this, and really that it's been a development from observational research to intervention research, then moving into more policy-related research in this field. This is work from my PhD, which was observational work. And really one of the key findings from that piece of work was that less healthy supermarkets actually seem to be exacerbating existing inequalities. Now, this is observational and cross-sectional, so there's no causal impact that can be obtained. But what is very interesting here is that if you look at the graph, we've got thirds of healthfulness of supermarket environments, with the first third being the least healthy supermarkets, and the third being the most healthy supermarkets. And on the left here, the bars in blue show women, the shops that women have shopped at, and this is their dietary quality. And this is from women who are living in situations of disadvantage. So particularly our measure here was educational attainment as a specific one. So these women left school with their GCSEs or less education. On the right-hand side here, we've got sort of grey-green bars, and these are women with degrees. And the line at 0, you can see is so above the line is a healthy diet, and below the line is a less healthy diet. And really what we can see here is that, yes, women experiencing more disadvantage have poorer diets, but actually there's a positive correlation there, suggesting that actually healthier supermarket environments may help to support healthier food choices amongst women from more disadvantaged backgrounds, where amongst women with degrees, we didn't see the same level of trend. And that in itself is quite interesting. So it made us interested in this area. And we actually approached first of all, we had a look at the evidence. So just wanted to take you to the evidence for prominent placement of unhealthy foods. And this work has been led by my colleague, Sarah Shaw. I forgot to mention my previous colleagues on the previous slide, Dr. Janice Baird and Professor Janice Baird and Dr. Sarah Crozier, who are in Southampton, that I've been working with for years. And really, to take you back to the systematic review, we were really interested in product placement as a strategy. And Sarah led on a systematic review. And this is just the highlight of the findings, which really show that healthy placement, there is good evidence to suggest, or moderate evidence to suggest, that healthy placement strategies do improve diet and purchasing behaviours. And you can see here that the positive means that it was having a healthy impact on purchasing and dietary behaviours. Much of the work was either 17 sort of from observational studies, and 22 of the articles were intervention. One thing I will caveat this with is that the robustness of the literature to date isn't always significant, but the direction of effect was what we considered. And really this is because actually conducting a robust clinical trial, randomized control trial or cluster control trial in a supermarket is quite challenging to have it adequately powered. So that's the main reason why the body of evidence was on effectiveness rather than significance. So based on this, we conducted an intervention trial, and many of you will be familiar with this trial. It's been in collaboration with the discount supermarket chain, Iceland supermarket chain, and we've conducted, this is the 2 components with them, a pilot study, which was an intervention study, and we're undergoing a full-scale study at the moment. The intervention trial is called WRAPT. It's Women's Responses to Adjusted Product Placement and its Effect on Diet. And this graphic here shows the components that were in the pilot study. Really, the key components were to remove sweets and all unhealthy foods. So all foods were removed from checkouts and end of aisles opposite checkouts. And they were replaced with water, sugar-free gum, and non-food items like tissues, paracetamol, toothpaste, soap, deodorant. And really this was to reduce any opportunity for a calorific purchase. In addition to that, we placed an expanded range of fresh fruit and vegetables right at the front of the store. and place frozen fruit and vegetables in the first aisle. And while you might think, oh, well, that's fairly standard for a supermarket, actually there is differences across the placement of fruit and vegetables at the front of the store, depending on the area and the type of supermarket. So this we felt was an important component. At the moment, we are, as I said, conducting a full-scale study. We've got 36 stores, and that study just looks at the fruit and vegetable component. And the outcome measures that we're looking at are store sales data, household purchasing data, and dietary measures for mothers and a young child if they have a child in their household. Just going to take you back to the results of our pilot study, which was published in PLOS Medicine a few years ago. And this is just for the store sales data. So what we did was took an approach that clustered the findings across the 6 stores, and we had a cluster controlled intervention trial. And what we did is paired the stores on sales data, area deprivation, and sales data, area deprivation, and customer profile. And what you can see here basically is that the intervention seemed to have a positive effect. So to the right of the 0, a positive effect on fruit and vegetable purchasing more than 10,000 extra portions of fruit and veg per store per week. And it had a moderate impact on confectionery purchasing, so 1,500 fewer portions of confectionery per store per week. So this was encouraging for a population level intervention and provides some evidence for the implementation of the food policy around placement that the UK government has introduced. I will say that what is interesting is this was just checkouts and end of aisles, and that it is definitely good to see that there's an expansion of prominent placement locations in the legislation. So we did consider this legislation. So with my colleagues, Sarah Muir and Preeti Juria, really this was a main thing to think about was about the conditions of effectiveness and equitable implementation, specifically for this new legislation. And the reason that we were particularly interested was initially around process evaluation for our trial, but actually it's really highlighted and, as I said, learned a lot about food policy and pre-implementation challenges for a novel legislation like this. So just to give an overview for anyone that doesn't know, viewers perhaps interested from outside the UK, this is a brief overview of what the regulation involves. So it was passed in 2021, and there's 3 key components to the legislation. The first is the definition of in-scope businesses. So they have to have 50 or more employees, have to have a store area of more than 2,000 square feet, and it includes non-food retailers, so clothing retailers as well, and home stores, and it also includes online. The criteria of which type of online retailer it complies, so 50 or more employees. The in-scope locations, there's 3 in-scope locations. I've illustrated 2 here, and this comes from the Association for Convenience Store Guidance. Really, the one here is the end of aisle, and the definition of end of aisle is within 50 centimetres of the end of the structure. It also includes checkout areas, and there can be no products that are banned within 2 metres of the checkout area. And it's also a 5% perimeter at the store entrance. There's no banned foods are allowed there either. One slight loophole is the placement of bins. So you can have display units that aren't considered end of aisle or near the checkout, and they can be included. The types of products that are included are HFSS products, and they're HFSS products across a range of categories, but predominantly ultra processed and high energy dense, nutrient poor foods. And there's an indication of some of those here on the slide. The HFSS is determined by the nutrient profiling guidance from 2004-2005. When we decided to think about having a pre-implementation evaluation, the first thing we did was a systematic review of qualitative literature on the area, on the field. So looking at stakeholder perspectives on food retail policy. So this work's been led by Preeti Juria. And what she really found was that there was 24 articles and they covered a range of different food retail policies. Some were being implemented or had been implemented, but others were being considered, like regulations on the sale or availability of unhealthy food and drink products. You can see here on the table the range of different interventions or policies that were included. And I just wanted to highlight some of the key themes from this work. The common themes were across the citizens, policymakers and retailers, which were the stakeholders that were included in these studies that came up in the systematic review. And basically what they said is that you need to have a clear scope and definitions of the policy. That's the number one important thing. The second was around building stakeholder support and capacity. And then the third was ensuring that there was equitable impact across subgroups. And this related to consumers and to businesses, that there could be detrimental or inequitable impacts for consumers and businesses. And from a food systems perspective, that's quite important for us to ensure that we do consider in the work that we do. One of the other things that were highlighted from the systematic review is that there were no views from enforcement officers or health groups in any of these studies. And that to us seemed to be a bit of a gap in the literature. So we designed our own study. As I mentioned, it was a pre-implementation evaluation. And we employed rapid qualitative analysis methods, and we interviewed a range of different stakeholders. The key findings of this work were published earlier this year in BMC Medicine. And you can see the details of the article here, should you wish to read the details. But the stakeholders that we spoke to were consumers or citizens, businesses, enforcement officers, and health advocates. We had, there was a threat potentially when there was a change of government last year for this to be revoked, and so we wrote a piece on the back of the work that we've done for the BMJ, and a piece in the conversation as well, really to try and say that actually there's some key findings, and one of those key findings is that it needs to go ahead, and these are the reasons why, which I'll go into a little bit more now. This was just to really say that the methods that we took were a systems approach. So we, as I said, looked at and interviewed stakeholders across the food system. And we employed the rapid qualitative methods. This is a reasonably new approach in qualitative research methodology. And it really became used a lot more in health research during the COVID-19 in terms of vaccine uptake and saliva testing. And we found this particularly helpful because it allows and facilitates for opportunities for feedback, and also allows you to assess views from a large range of different stakeholders, which was one of the key things that we wanted to do. So the reason I'm sharing this is that this could be a potential opportunity or method to approach food policy implementation, and really understanding the context and conditions in which that policy is being implemented, to allow it to be refined and some of the concerns to be addressed by stakeholders. What we did is we spoke to 108 different stakeholders. They were semi-structured interviews, mostly. Some were group interviews. And across that, we had roughly a quarter were health advocates, so they were academics or working in non-government organisations, and some local government authority, public health workers, professionals. We spoke to citizens. 32% of our sample were citizens. We spoke to businesses and a range of different businesses. This included retailers, obviously, but also manufacturers and suppliers as well, to ensure that we were thinking about wholesalers and manufacturers in addition to retailers, again trying to cover that sort of food systems approach. We also took note of the finding from the systematic review, and interviewed enforcers, and enforcement of this particular legislation is the responsibility of local authorities. So in really it's not responsibility of public health teams, but much more the responsibility of public environmental health and particularly trading standards officers. So state trading standards. So the Chartered Institute, the Chartered Trading Standards Institute is heavily actively engaged in this particular legislation. We also partnered with the Chartered Trading Standards Institute and the Consumer Goods Forum to hold a free online conference for particularly small businesses and enforcers. Some of the things that we heard through our interviews was that actually there wasn't a lot of support, there wasn't a lot of information that was available in an easy format for these groups. The grocer and other big organisations did hold quite costly events, and they went for several days and they costed several £100s to attend, and small businesses enforcers just told us they didn't have the capacity or the resources to be able to attend those events. So we partnered with, as I said, the CTSI and the Consumer Goods Forum, but we also had presentations from the British Retail Consortium, from the Association for Convenience Stores, and our own research was presented at that online conference as well. And we used that conference as an opportunity for participatory research and validation of our findings. And I'll talk a little bit more about how we did that, but that's another thing that I think is really important in terms of confirming the context and conditions in which we are assessing and we identify through research that is looking at pre-implementation of food policies, and then using that to form recommendations that can be passed back to policymakers or to different other stakeholders who might be able to better improve the equitable impact or implementation of the food policy. I just wanted to talk through some of the key themes that we found. There was really two key themes from this work that we did. So across the 108 stakeholders, really what we heard is that actually, by and large, people supported it. They said that the legislation was largely a good first step to addressing obesity and to helping to support citizens to adopt healthy diets. But there was a but, and the buts really related to these sort of themes here. So the first but was the exploitation of loopholes. So one of the business stakeholders said, well, that's the kind of thing that worries me a bit. Are we really going to replace this with something that's good for you? So it was a recognition that alcohol was a loophole and that alcohol might be promoted much more. And we have seen that alcohol has been promoted a lot at end of aisles. In terms of exploitation of loopholes, there's also been the exploitation of the definition of prominent placement, and that, you know, bin drops have been used quite a bit. So that was something that we did hear about. And that is, again, something that we could use in terms of feeding back for potential policy refinement over time. Turning to the right of the screen, exemptions for increasing inequalities. So there's certain exemptions. As I said, small stores are exempt, and there's other particular exemptions in terms of food. And so what we've really seen is that things like unpackaged baked goods are exempt. And so there's certain things that might actually increase inequalities. And here an enforcer said a significant number of small businesses won't be caught by these regulations, and our children are going to those smaller stores after school. So there was a real concern that the groups of citizens who use these smaller stores are actually those that are most susceptible to having poorer quality diets, and that this legislation may in fact exacerbate inequalities, something that we need to consider in all evaluation of this work. We also heard that it was a complex issue. The definitions of the three components are quite complex, but there's recognition that the obesity and poor diet is a complex issue, and that this issue will only be achieved by a suite of policies. So this health group advocate said that this policy, alongside others, is really important to address childhood obesity. So again, seeing it very much as that first step. The last point that came up, particularly from consumers, but also from other groups, was just about this imbalance of food cost. And one citizen told us, I do strongly believe that the government should keep the price of sugar and fat foods higher and the healthy foods lower in price. And of course, that's ever more apparent now at the moment with the cost of living crisis. Moving on to the second thing, we also found that there were concerns that inconsistent approaches may affect impact. The first one was around complexity. So as I mentioned earlier, there is lots of complexity in terms of the definition of HFSS if you don't have a HFSS calculator or nutrient profiling model calculator. There's complexity about knowing for enforcers to know what the size of the store is, to know whether they should be complying or not. And here's a quote from an enforcer who said using square footage to determine in-scope businesses is complex. Will not be sending officers out with a tape measure. We also got told that there were significant resource limitations, particularly for enforcers and for small businesses. And here, enforcer said, you know, we've got limited resources and you have to target those at the stuff that's probably most imminent risk. And this legislation came in a little after the Natasha legislation around food labelling, and that was considered to be a much more urgent health risk and therefore would be prioritised. Over to the left-hand side of the slide, the other thing that we told about was inconsistency in priorities. And that some businesses, for example, we've got two conflicting quotes here, where some businesses will say we do promotions to attract customers to buy stuff. If we can't do it and they go to a supermarket, obviously we're losing customers and we're not going to survive. So there was a real concern and a priority on business outcomes, where another business stakeholder saw this as an opportunity. There could be a rush to the top, as it were, instead of the bottom. So we're all trying to find new ways to promote healthy stuff. So the range of different factors that we heard. As I said, we asked then for confirmation of the recommendations. So lots of recommendations came out through the work that we did. And what we asked at the online conference was confirmation of the recommendations and prioritisation of these recommendations. And this is the list in priority order that our over 340 delegates at the conference confirmed. So this first one was to make sure that there was a central HFSS calculator that was free and readily available, culturally appropriate foods are included, and it was updated. And that hasn't happened, nor does it look like it will happen. Which is interesting because even the business community were really calling for this across the business community to make it centralised and free. The second was around refinement of the legislation, particularly the intent and clarity, so to close some of those loopholes and to ensure that that there was a clarity around what it was about. Some of the smaller stores were unclear of the intention and what it was trying to achieve, so the health benefits. And this, of course, we might be able to feed such information or findings back to policymakers at national government to ensure that there is clarity and understanding of the intent, which may actually then optimise implementation. The third was to conduct a robust evaluation, assessing intended and unintended effects, something that we're all very familiar with. And the fourth was around greater support for small businesses. The larger businesses have access and are creating their own HFSS calculators. They're able to throw a lot of resources at still ensuring that their supply chains can keep up with new lines and that they're offering a range of new lines and working closely with manufacturers. Unfortunately, the small businesses haven't got these opportunities. And enforcement officers were feeling that they had a lot of responsibility to support small businesses. Obviously, Association of Convenience Stores and other sector-led organisations have been supporting small businesses, but again, they don't necessarily have the resources to individualise that support. The fifth one was around ring-fencing resources for authorities, and this has been particularly important, and I'll come back to this shortly. And then the sixth one was really around creating and communicating a long-term food and health roadmap. And this was quite interesting. We heard this a lot from businesses that actually we're a bit confused as to what the prioritisation is. Is it reformulation? Is it HFSS? Is it advertising? Is it, you know, where should we be allocating our, is it a sugar reduction? Where should we be allocating our effort? And actually having clarity on, you know, a longer term 30-year roadmap about where we wanted to go with the food supply might be quite helpful. something for us in the academic community and as equity and food advocates to be able to think about how we might be able to support and get discussions around cross-party agreement for a longer-term food and health roadmap. I said I'd come back to the enforcer findings and the ring-fenced support for enforcement and for local authorities. And really, we've taken each of the findings, so the in-depth interviews that we've done, and the interviews that we've done, we're doing an in-depth analysis. This work is being led by Preeti Juria, my colleague, and doing an in-depth analysis to understand the nuances with each stakeholder group. And again, I think this is really important for shining the light on conditions and context. So there's a new enforcement framework with one of the major themes that's been coming up with enforcement officers, that this is new, it's such a novel type of legislation. And this quote here from the enforcement officer says, it's so ambitious. How many bargain buckets do you need in a row for that to constitute a denial? And that's going to be hard because you'll have someone in Cornwall saying no, 6 in a line, and I know that that's denial, but you might have an officer in Lincolnshire saying no, they're just buckets, they're fine. So it's completely different level of complexity. And as I said, this is mainly trading standards officers and environmental health officers, and less about public health, although some local authorities did talk about good cross collaboration and engagement. But there's a real consideration that this is a new framework for enforcement. Down the bottom was national government leadership. And really, it did come down to saying it's tricky to see any long-term enforcement without funding. And there was lots of talk about the need for project funding to ensure that it was going to be enforced. There was some more optimism from other local authorities about regional and local activities that are ongoing that might better support enforcement of this legislation. So one enforcement officer said, we do have a good food retail meetings, environment health is represented, our business support team is there, our public health team is there, and we've got a social enterprise in our borough that works specifically around food that often gets commissioned by the council. So there are other support things in play that might help with this legislation for the settings that are below the threshold. So again, there was recognition that some businesses may need better support in an effort to ensure that there was an equitable and consistent implementation and equitable impact. The lack of enforcement has been highlighted in a really recent article from Kantar that talks about an article that was in the convenience store, which is a publication for that sector. And they had a freedom of information request. And what they found is that there'd been very little enforcement actually by the end of December last year, when the legislation had been in place for 3 months. That only 2 enforcement notices had been given by 2 different local authorities. The freedom of information request also showed how small the budget was that was given to local authorities to enforce this legislation. And misspelt the years here, but for the first year of implementation across all more than 300 local government authorities, there was £179,000 that's been allocated. And then the next year, the second year of implementation, that will go down to 102,000. So they really could argue that there hasn't been the support. And I guess, again, thinking about what we might do as an academic community, I think feeding this back regularly and providing the evidence for policymakers to be able to make the case to politicians may help to change the resource allocation and make sure that food policies have an opportunity to be implemented well. This was just to end this section of the presentation to share lots of pictures that I take in supermarkets. I'm sure many on the line do as well, and the difference that we are seeing. So top right is not such the good news. This is just outside that 5% of the store entrance, and it's in a large superstore, and it's just covered with alcohol and chocolate and Easter celebrations, and it really is just exploiting all loopholes. The bottom left-hand corner is similar exploitation of loopholes. This was at Christmas time, and you can see they're just huge bin drops. Stacks of boxes of the Christmas confectionery. And what they'd actually done in this supermarket was expanded the size of the first aisle and dropped the bins that are allowed right down the aisle. So it acted, if you like, as another aisle, but it's well within the scope of the legislation and permitted. There are a few positives. So you can see bang in the middle there, some nice non-food items at the end of aisle in a convenience store, in a supermarket, which is great. I thought, you know, some homewares, and obviously top left is was when the legislation was first implemented, and this whole entrance of this supermarket was just pumpkins and water, which I was pleased to hear. So be nice to share stories of any examples that you have seen compliance or lack of compliance. The next example that I wanted to talk through is the Healthy Start scheme. This is an important scheme, particularly at the moment for so many families who are living in really challenging circumstances, and this can make such a big difference to help to feed young children well. I'm sure you're all very familiar with the Healthy Start scheme, but for those who aren't, again, maybe international audiences, this is a government food policy that provides payments for families with children under 4 years and are on low incomes. What the payment includes is £4.25 each week, and this is for pregnancy from the 10th week of pregnancy. You can have it right through to the baby's born, and then it starts at £8.50 each week from when the baby is born to the first year of life until they turn 1, and then the subsequent years from age 1 to 4 years, it's back to £4.25. And the children are also entitled to free vitamins. The £8.50 is intended to cover the cost of infant formula for parents or families that aren't able to breastfeed. And this can have a really significant, make a significant contribution for families' food budgets over the course of a child's life. It can contribute £1,200. And actually, if you're thinking about having more than one children, if you've got twins, this can make a really valuable contribution. And particularly at the moment, so just again to heighten the cost of living crisis that we're all very aware of, these data come from the Food Foundation. It really is just to show that huge numbers of families in England at the moment are experiencing food insecurity. These data come from January this year, and I believe that there's going to be a new release of these data soon. And so it'd be interesting to see what's happening, but my guess is it's not coming down. The work from the Food Foundation, their food insecurity tracker, also provides some interesting data and some very contextual data around food insecure families and what they're buying. And you can see stark differences in fruit. So the yellow bars being food insecure families, and this is the percentage of households reporting buying less of these types. So over 50% of food insecure households bought less fruit compared to just over 10% of food secure households, and you can see similar patterns for vegetables and fruit. So the scheme, like the Healthy Start scheme, is very important. It allows families to buy fruit and vegetables, milk, infant formula, and beans, pulses, and lentils. Really just wanted to highlight some work that's been done by our colleagues at the Centre for Food Policy. So we've got Dr. Anna Isaacs at the top right, Charlotte Gallagher-Squires, and Paul Coleman at the bottom, and they've been working in the NHR-funded policy research unit that focuses on obesity. And this work is part of a Food Foundation publication that really looks at the context of people's everyday lives. And it's been really interesting to see that, again, it just highlights the time pressures that families experiencing food insecurity are under, that there's challenges around leisure, allowing leisure activities, and so food becomes an obvious leisure activity because it's cheap and it's sociable, and family members have food preferences for those foods. There's real context concerns around equipment and cooking and storing of food, There's busy lives in terms of having time pressures to even think about food preparation, and the environments in which people are living and the food environment makes it the logical choice is to choose the affordable food, which is highly palatable and easy to prepare and highly processed. So I definitely recommend reading this. It's about the cost of living crisis and the impact that it's having on families. And again, it helps us to contextualize how some of these food policies might be landing and being implemented and what we can do to support that. So the reason for really talking about the Healthy Start scheme is that I'm leading the national evaluation of this scheme with my colleagues Millie Barrett and Mark Spires, alongside colleagues from Southampton and IFS. We are working to do a national evaluation of the Healthy Start scheme. It contains a number of components. We've got a large number of partners, all of whom you can see their logos on the slide. And we're working very closely with 3 specific communities, Southampton, Redbridge and Manchester. And our colleagues in these 3 areas have been very open, and it's really allowing us to do an in-depth investigation of the Healthy Start scheme in these 3 areas. So this is the work that I'm going to talk a little bit about, because I think it gives us very good contextual focus on the implementation of the Healthy Start scheme. And one of the reasons that this work was commissioned by PRP, so the Policy Research Programme of NIHR, was really because DHSC were interested in finding out what the gap was with uptake. They've introduced the new digitalisation of the scheme, came in, so it's a payment card from the 1st of April last year. And that's been, it was recognised as being important because there was still use of paper vouchers and retailers had to sign up for paper vouchers, and they had an expiry date, and there were various concerns with that. But the move to digitalisation is almost like implementation of a new policy to some extent, because it's been a very different implementation, a different sign-up process and a different usage process for families using it in retailers. So it's been really interesting, and this has taken the focus of much of our work in terms of the lived experience package and understanding the contextual barriers and conditions in each of the 3 areas that we're working. This is also just to highlight that we are looking at diet and purchasing patterns as part of this programme of work, health and educational outcomes for children, that is being led by colleagues at IFS. And then the important part, bringing it back to the lived experience, is around co-producing solutions. So once we've heard and engaged and we've shared and have an understanding of the conditions and context in which Healthy Start is being implemented, the idea is around co-producing solutions and really having participatory research. So I think that's another real key component of optimal implementation for equitable impact of food policies. And I know this is becoming more and more common, but actually I think the way in which we do it, we're learning still how that happens. So I wanted to share with you some emerging findings that Millie and Mark have been busy analysing. And these are some families' experiences, and this is from the same mum who it's an example of one mum, and it's stories that are similar that we're hearing coming from mums. I just want to caveat that by no means are these data complete. These are very emerging findings, and we're conducting the rapid qualitative analyses and feeding that back to policymakers as quickly as we can. And I think Millie and Mark and our colleagues, which we're working with the social enterprise, have already interviewed sort of about 65 stakeholders and participants, which is really great. So coming back to the mum, one of the things that she's really made that we're hearing is that payment cards better. This particular mum said having the digital card is so much better. I have more flexibility as to where to spend the money. It makes a huge difference. There are no problems using the card, and it doesn't expire like the vouchers did. I have much less anxiety using the card. And that was one of the key areas. There was a lot of stigma with the vouchers. Sometimes it was quite clunky in the retail outlets, and it would take time to be processed, where there's much less anxiety, much less stigma around the payment card, which is a real benefit of this implementation. There is complexity though in terms of eligibility and signing up to the card. So when it works really well for people, it works well, but we have heard some families, including this lady, who have found the sign-up process and receiving the payment card quite difficult. So this mum said, I would have given up if the midwife I happened to meet at a local baby event had not intervened on my behalf. The refuge workers tried, the Sure Start people tried. No one could help me until there was a personal contact at NHS Business Services Authority via this midwife. This is definitely not a robust or fair system. And that's a really insight. And I know NHS BSA are working hard to correct and make the system as simplified as they can for people. But the eligibility criteria is quite complex. And we're hearing that from families. And that is maybe a clear barrier to why uptake is lower than ideal. Just to also share some of the emerging findings from supporting stakeholders. Limited resources at a local level is a key factor to supporting families to sign up for Healthy Start. This was an early years worker working in a children's centre that just said, we don't have the budget for printing. We don't even have colour printers in the children's centres. We can't print the flyers and the leaflets and the posters provided by NHS BSA. A digital promotion pack just isn't enough, not for this area. So there might be some localised resource concerns. Similarly, there was a call for leadership and accountability. One local policymaker said to us, Healthy Start should be everyone's business, rather than just one person's responsibility. There are many professionals that come into contact with families. If it was on everyone's KPIs, then we would all be accountable. So a call for some leadership, and again, how this might happen is very contextualized and the conditions of delivery and supporting there. So much more to think about. And also we've spoken to retailers who are heavily engaged in the promotion of Healthy Start. And one retailer said, actually, do you know that we can do more? Said targeted promotion of the scheme in certain geographical areas where uptake is low. This is an easy ask to retailers. If we all act together in a specific postcode or local authority, everyone would be up for that. So there's really goodwill because there's great recognition that this can make real benefit to family on the ground. I just now wanted to think about, in the light of the two examples, thinking about policy coherence and some of the work that Paul has done as part of OPRU, the Obesity Policy Research Unit. And his current project is assessing food policy interactions across government. And one of the really interesting and somewhat unexpected findings was about the intermediary role that regional health officers play and what a crucial role they might have in terms of easing implementation or optimising implementation of food policy. So this regional health officer said, we hear things through our national partners around what they're doing, and very often we have to make those links with others, and we what we call communities of improvement or networks on a regional basis. So that's how we might come across government policy. So they very much have this intermediary role, working with local stakeholders and local authorities, and then also working with national. And I guess it's about that lines of communication and how might that play a more active role in implementing food policy so that they can be effective for all. I just wanted to raise policy coherence. This is one of the modules and topics that we cover in our MSc program in food policy, and students are always very, very interested in food policy as a concept, and also methodologically how to apply it and for benefit. So really, for those that are less familiar with the term policy coherence, it's really about the alignment of policies that affect the food system with the aim of achieving health, environmental, social and economic goals, to ensure that policies designed to improve one food system outcome do not undermine others. And much of the work around food policy coherence has been at a sort of document at an aims and objectives level of food policies, and are the aims and objectives of food policies aligned across government departments? So is DEFRA aligned with DHSC and Department for Education? But actually, when we're thinking about implementation of food policies, yes, that's absolutely essential, but maybe it's also about policy coherence at a regional and local level as well, and thinking about policy coherence in terms of local governance. So that's just something that I think might be an area that we could further expand on policy coherence. This excellent publication by Emma Parsons, who a previous member of the Centre for Food Policy, really talks about different mechanisms for connecting food policy. So well, these are the mechanisms in which you might achieve policy coherence. And I think for, again, implementing food policies in a way that is equitable and effective, actually maybe some of these, what Emma calls as softer mechanisms, are really important, and we pop a sharper lens on them. So day-to-day connections, issue-specific projects and supporting groups, some cross-government food-themed groups, and maybe we talk about cross-governments, food-specific policy groups, so that actually there's greater ways of working, and are we able to facilitate that, and what role do we play as academics and health advocates to be able to facilitate some of these mechanisms or methods that can be used. There's multi-stakeholder advisory groups or working groups, for example. So I think it's definitely an area which we could consider further, and I look forward to hearing your thoughts on that proposal. I mentioned local governance, and our colleague Christopher Yap, again working at the Centre, has done some great work in this area and lots of thinking about local governance and its role in ensuring that food policies are not only implemented in a way that considers conditions and context, but actually that there's a level of power and control over that as well. Even if they do come down from a national level, it's about the implementation to make sure that they're right for the community. And local governance, thinking less about the role of government per se, but about civil society organisations, about citizens, about businesses, and how we come together to ensure that there is good local governance around policies. And again, I think this is really helpful in terms of implementation and optimising implementation of national policies to fit the local context. So the role in governance and how we might be able to pursue that further as a research area with this particular lens. One of the other mechanisms that is being undertaken and explored further and tested with our colleagues at the Centre for Food Policy. So again, we've got Charlotte Gallagher-Squires on the top, Samyat and Anna at the bottom, who are working here on a participatory research program. And this is a really great piece of work that I think brings to life what we're hoping to do in the Healthy Start program around co-creating policy solutions. So my colleagues are working with households, families of have children who are experiencing socioeconomic disadvantage, and they're working really closely with them using some really creative and novel methods to think about policy options that are right for the context in which these families live. They've got sort of two phases outlined here. The first phase is an inquiry phase, and it's fun. It sounds really great fun, where they've got a photo voice, so asking the citizens that they're working with to take photos and really explore their context and their world in a very lived experience method, adopting lived experience methods, but also really getting citizens to think about systemic and food systems influences on food choices. And I think this is really exciting because it links quite very nicely with this sense of food citizenship and an ownership over the environment in which we live and the context in which we can make food decisions. The next phase of this work is around co-designing policy implications that are fitting for the environment, as I said, in which families are living. But this work involves a lot of capacity building and training around facilitation, presenting, and that the families will actually be leading on these workshops. And that is very exciting, and policymakers will be invited in, and the photos from that have been taken and thematic analysis that the citizens will have engaged in will all be part of the workshop and the co-design of the policy recommendations. A really exciting piece of work that I'm watching with great interest and learning from. Well, just to wind up, really, I wanted to say that I think one of the key way in which governments at the moment approach pre-implementation of food policies around consultation. And this is absolutely essential, but it is a very top-down approach. And again, I ask, what are the things that we can be doing as academics to better support equitable implementation of food policies? And we need to absolutely contribute to consultations and allow policymakers to do what they do well. But actually, it is about us thinking more about the conditions in which these policies are going to be implemented, how they might vary, who they're affecting. And this is my final slide that I really throw out there. It's in development, it's embryonic. And on the left of the slide is very much around the methods and approaches that we might consider, all of which I've touched on today, that really we do play a fundamental role. One of the key things I think is really important is this rapid analysis and feedback, and that it's to not only policymakers, but also citizens and stakeholders who seem to be missing from the slide. So as I said, it was work in progress. Anyway, I'd just like to thank you all for listening. I hope it's been of some interest. I need to thank our funders, of whom is NIHR Public Health Research Programme and NIHR Policy Research Programme, and also disclose that the views expressed tonight are my own and are not the views of NHS, NIHR or the Department of Health and Social Care. So thank you very much.
Well, thank you very much, Christina, for an amazing array of thoughts in terms of what you've done and where you're going now, and some visions for how we can extend and engage in the food system for change. So thank you very much. We've got a lot of questions coming through. We've had many questions coming through already tonight, but please do continue to put your questions into the Q&A box underneath. I've tried to curate a few of the questions that have already come through. So do you need to take a drink of water, or shall we dive straight in?
I'll take a quick drink as you're sharing the first one.
Okay, well, I've got two definitional ones to ease us in, as it were. So the first question comes from Steph Maxwell, and she was just wanting to understand your definition in some of your early slides, but also now, possibly, about your definition for healthy and unhealthy supermarkets. So yeah. I guess just let's go from first principles. How do you actually define those things?
So we looked at a range of different factors. It was a bespoke tool that was developed and looked at shelf placement, product store placement, price. What else did we look at? Labeling, availability and variety. It was a composite score, if you like, on a select number of items that directly related to the dietary measure, in the food frequency questionnaire, which we used to measure diet. So we had it's pushing my memories, I think 12 different food products. It might have been 14 that we looked at, and there are a range of staples like bread, HFSS products, and also healthy products, particularly sort of selected fruit and vegetables, which were markers of better quality diet or poorer quality diet. And then came up with a composite score.
Thank you. That's really helpful in just kind of thinking through what was or is an unhealthy supermarket or a healthy supermarket. Ebba Goodwin has also asked, and this was something I kind of was Googling in the background as well, in terms of the term enforcers. Do you want to just talk a little bit more about what an enforcer is in kind of your definition, and how do they engage with food policy? Because they are just enforcing the policy, or are they helping create the policy? What's the interface between them?
Yeah, I think that's very dependent on the food policy in question. In the case of the placement legislation, placement and promotions legislation, it's very much local authorities. And it was said to the local authority team, doesn't matter really who's taking this, but whoever is best placed. But it really wasn't appropriate for public health, where it might feel like an obvious fit. It was really much more appropriate for not even environmental health, but for trading standards officers, because of their ongoing links with retailers. So my understanding is that during the consultations that happened prior to policymakers deciding they were going to bring in the legislation, that there was lots of questions around who should enforce it, how could it be enforced. And because it's a very place-based legislation, that it needed to be on the ground. And there really was a decision that actually probably local authorities are quite well placed in some respects because they're visiting retail outlets anyway. But the complexity around that is that this is a new legislation. It's a novel legislation. It's different in many of the ways that I described, which just, I think there has been a bit of a gap sort of from the enforcers that we have spoken to. There has been a gap in terms of them needing more resources and support to be able to adequately implement it. But I think the term enforcer is someone that is responsible for infringement notices and ensuring that whoever is supposed to be implementing the policy is doing it appropriately.
Thank you very much for that clarification. And that's fascinating, coming from my own perspective of looking at environmental health and who is actually responsible for these different sorts of things. So really interesting to think about this new policy being rolled out. If we switch tracks just slightly and think, there's two questions on economic impact have come in. So I thought we'll get them out the way early and we can switch back to health if that's okay.
Yeah.
But so Ursula Ahrens is asking, has any assessment been published of the economic impacts to the retailer for Unwrapped from changes to placement strategies? So this is kind of thinking about maybe retailer benefit of sales of fruit and veg versus confectionery.
Yeah, so great question. And there's very little in food retail research focused on health around economic impacts. We did do a very crude evaluation on individuals in our pilot study. So there are literally a couple of lines. But as far as the full-scale study, we have Professor Joe Lord at Southampton, who is a health economist that's leading on 3 perspectives of economic evaluation. Individual level, so not only about usage of stores, but cost and spend. And we have survey data and household purchasing data to support that evaluation. We are also conducting a retailer evaluation. And it's complex because it's not quite, when we speak to the retailers, it's never well, this was the profits at the end of the day, because there's reinvestment. The intervention that we used and also HFSS legislation has required reinvestment in infrastructure. So that's seen to be an investment which you can't quite measure easily and simply. I think there's also commercial sensitivities around working with one particular supermarket. But supermarkets do, certainly large chains have resources to be able to work with their supply chains. I think one of the biggest things that we hear and have heard is it about the preparation time that's necessary. So one of the reasons for such big displays at Christmas last year was that those Christmas purchases had already been made, well and truly 18 months earlier. And so some of those conditions, I think, make they're just misaligned with what our expectations are in health. Just to say, the final thing that we're doing in WRAPT is a societal impact evaluation as well. So using the impact model to look at its impact at a societal level versus disease at later life.
Really interesting there. And again, some fascinating things that you're doing within the WRAPT program. Just doubling down, I think you've answered this, but just to double check. So Javier Martinez is asking about, I guess, the cross-price elasticity, because, at the aisle, there was small things that were available. You've taken them out, but big things are still available elsewhere in store. So right now you've not looked at that, but that's going to be looked at in the WRAPT study in the future. Is that correct?
Yes. Yep.
Right. Okay, just wanted to double check there. Just some fascinating interplay there, but as you said, it's all complicated. Right, well, there's another question that's come in that's slightly left field, which is from an anonymous attendee, which has been asking about, it's great to hear that there's placement research, but has there been anything looking in terms of online spaces and online shopping behavior and how that links to these placement activities as well? Do you have any thoughts on that?
Yes, it is. It's not my area of research, but there is lots of work being done at Oxford University, so part of Susan Jebb's team. Then they have done a lot of online trials because you can have much more controlled scientific environments. I think with a lot of the scraping that's been done by others in in the UK in terms of data, that there will be analysis of that online environment and the impact on the online environment. But the honest answer is it hasn't been a particular focus of ours, and that is largely because there has been inequalities in online shopping pre-COVID, and that's really where our study started pre-COVID. So it was less of an interest in terms of addressing dietary inequalities.
Thank you for that that clarification there. Let's move on to, I guess, there's a pocket of questions we've received around differences within food product categories while shopping, and I thought I would just group them together. And it was just different people, some anonymous attendees and also Seth Cook, have kind of highlighted differences in the food available at the supermarket and how you kind of define that. So Seth, for instance, is highlighting high fat, salt, sugar standards. Isn't there healthy and unhealthy fat, so PUFAs versus others? How does that actually work out in practice within your analysis because of processing of foods, etc.? And then also just thinking about the access to meat, fish, poultry, other sorts of things within a supermarket environment. Are you looking at any of these other complexities, as it were?
No, the honest answer is we're not considering this, but this is completely aligned with your interests, Christian, and and others, that around how it can be looked at. Certainly, there is some research that from the LEAP study, which has been done in collaboration with Sainsbury's, where and that's been published in PLOS Medicine. I think it came out in 2021 or 2020, and that was very interesting because they looked at the placement of meat alternatives. So not directly related, but somewhat related to more sustainable diets and how we can structure in supermarkets for more sustainable diets. Look, I think in terms of a retail environment, there's lots of scope for potential improvements and supply chains, and it's complex. And really, one of the key things around this particular legislation is it's the first time that governments have actually put a mandate in terms of healthfulness of foods on what supermarkets can do in their own stores. And that's interesting, and it's it's paving the way for then policy refinement and improvement for healthier, sustainable diets going forward.
Brilliantly said there. So let's move on to, say, your Healthy Start work. And there's been a series of comments that have come out about your Healthy Start, so it's questions, I should say, rather than comments, about your Healthy Start work. So I'm going to try and merge two together from Lucy Antal and Audrey Orban. So Lucy asks the question of, how do we get policymakers to take Healthy Start seriously? Because what happens if there's nowhere to use in the immediate vicinity? So nothing done to address the immediate access to food. How can we get policymakers at different levels to take Healthy Start seriously? But then Andrew is also coming and asking around something you highlighted, that is a lot of parents don't know this exists. And it's also maybe, how can you get supermarkets to promote access? How can we get policymakers from different levels as well as supermarkets to start taking Healthy Start seriously? What are the different steps we could be doing there?
Yeah, the honest answer is I'm hoping our research will tell us that. We are still in the early stages. The interviews that we've had with retailers is they really want to support this. So big retailers really want to do everything that they can. We're still recruiting smaller retailers, and it's more challenging for them to promote it, except much more locally with their citizens that come in to buy from their stores. But the big retail chains have done lots. They've through COVID, a lot of them did add-ons, their own add-ons. Before Healthy Start price increased to $4.25. It was $3.10 before that, and so a lot of supermarkets have done that. Sainsbury's has still introduced that again. It's a coupon, so that if you use Healthy Start, you receive a coupon, which means you get more money off next time. And all those things are to incentivize people to take up Healthy Start and to use the card. So I think retailers are doing a lot more. I think there is about a coordination. So some of the retailers that we've spoken to have said, this is something we're happy to coordinate on and not compete on. And players like Sustain and the Food Foundation have been absolutely fundamental in bringing retailers together to be able to actively promote this. Data was one of the concerns that has come up with some of the retailers around wanting better understanding of how the data can help them to target promotional activities. In terms of policymakers, I think it's really interesting. Obviously, Healthy Start sits within DHSC, but the all the information about eligibility lies with other government departments. And so there needs to be quite close working relationships around that. And with the digitalization, it's made much more close working relationships. So I think across government departments, that's happening. Whether it's happening at the ministerial level, I'm not sure. In terms of regional and local governments, actually, the cost of living crisis doesn't, highlight locally elected councillors to think, wow, we should be doing more, then this is a prime opportunity. And it is one of the key things that we're focusing on in terms of the solutions and the deliberative workshops that we're holding, and feeding back to councillors very localised information which they want to be able to say, in my community, the promotion needs to look like this rather than that.
Really clear, concise point there. And so we're mentioning there that it needs to be tailored to the actual community. And we've had a series of questions that are asking actually about, I guess, local food markets instead of supermarkets. So the other alternative pieces here. Just to understand, is WRAPT looking into this alternative market, or are there other policies or mechanisms we need to actually be engaging with traditional markets among that?
Yeah, so WRAPT isn't, so we haven't looked at that. But again, I think in terms of local food networks, they play a vital role for many communities in terms of facilitating availability of affordable fresh produce in particular markets. And they're nice, vibrant places to live. So thinking about context and conditions, actually, they can be a real reason and part of why you want to go and spend time in your local community is because of the hub of the local market. So it's not work that we are doing directly, but we are very interested in the role that local markets and food vendors play for Healthy Start. And many, if they don't have a card machine at the moment, they now can't accept Healthy Start vouchers. So this is a point in which we are exploring further through our qualitative work to, again, potentially identify solutions that might be able to be implemented in a systemic way to overcome that.
Thank you for that. And I think that answers the questions around the local markets area. There was two separate ones and you hit them both on the head precisely there. Again, just remind, please put your questions into the Q&A. And some of the questions, though, are asking, will this be recorded? And the good answer is yes, it is. This recording will go on to the YouTube channel for the Centre for Food Policy, and you can watch it probably in about a week's time and share it on social media, etc. Right, back to the questions there, Christina. So we were talking about incentives to get retailers, and you were highlighting that they were saying, let's not compete on this, let's work together on this. Are there any other incentives that we need for retailers to promote healthier shopping? And then another attendee has also been asking around the low financial commitment for enforcement of this legislation. So what are the other things we need to do to get other groups involved in actually enforcing this legislation? So what are the incentives we need for retailers, and what do we need to promote for manufacturers, sellers, advertisers, everybody else to come on board with this as well?
Yeah, what do we need for retailers is, I think, a really interesting one, because I think it needs to be much broader than the scope of this particular legislation, and everyone would agree with that. And the advertising legislation that is now being delayed to 2025 it will hit retailers, but it will hit manufacturers harder. So there is still a better role for retailers. I think refinement of this legislation and including discussions around it. So a lot of what came up through our interviews was about the letter of the law versus the spirit of the law. And there really was heterogeneity in that. And as I described through some of those quotes, that some businesses really did say, I'm going to sell as much confectionery as I can, but I will do it to the letter of the law. But I promise you that I will still be doing it because that's where we make our money. Where others were like, well, this is an opportunity. So I think, again, it's the food system, it's about suppliers and manufacturers, but actually it's more systemic and thinking more about some of the strategies that are across the food system, aligned with, the National Food Strategy and other conversations, that it's a much bigger, broader discussion. I think the reality is that what we hear is the commercial imperative is the most important thing. And of course it is, you know, they're there to make money. They're there to absolutely provide food for their citizens, and they want to do that and do it well. But it is still, I think, a system is against. So I think it's a systemic answer is that one, and building the case for that in the way that we are. But I guess the lens that I would put is ensure that we consider who needs to be in place to ensure implementation of it in an effective way, so that it can be equitable. The other question I've gotten, sorry.
That's fine. I think you've covered both of them there in terms of just what do we need for retailers and that wider environment. And you've said those different factors to bring everybody else along on this journey. We're rapidly running out of time. There's an amazing amount of high quality questions within the chat. Thank you so much. If there's something you've missed tonight, please do reach out to Christina over Twitter, over email, etc. I'm sure she'll be glad to answer your questions. I've got an interesting one here to finish up with, if that's okay, Christina. And that was just an anonymous attendee has asked, could you talk about maybe some of the unintended consequences that you found of policies like Healthy Start? So are there unintended consequences that impact on the food system from these different sorts of either placements or Healthy Start that are either positive or negative?
Yeah, I think that's really interesting. Again, I think that's why I'm thinking about optimizing implementation, is because there are unintended consequences. One of the quotes that we had from one of our communities was to say, because we have such a difference in uptake of Healthy Start in the community, that in itself is inequitable. So, do you know, are there that some families know about it and can you know, sign up, and others that are eligible are missing out? That in itself is a unintended consequence, that there is inequality. So I think by considering the ways that we can optimize implementation to maximize everyone that's using this, and then throw extra energy and effort and resource at those that are most likely to miss out on the benefit, be it business or be it, you know, a family, I think that is really very important. So some of those things are already being seen through the work that we are doing. I think one of the other things is using the HFSS legislation as an example, really was around the in-scope and out-of-scope businesses. And again, that there's a much more system solution that's required around suppliers for convenience stores, so that actually the default isn't to sell HFSS and alcohol and tobacco, but actually there's a better support mechanism around what they can stock in their convenience stores that will still have a reasonable shelf life and sell in their communities.
Amazing. And again, it's just fascinating thinking about those inequities and differences of different food system impacts caused by the policy. Well, thank you very much for a very wide-ranging and rapid-fire question and answer session. It seems we've covered a lot of ground there in some amazing detail. And thank you again for just a marvelous presentation about the research that you've been doing and your new food system thinking and where you're wanting to take this. So thank you again. I think everybody in the room can be applauding if you want. Thank you so much. I would highlight again that this will be recorded and you can watch this on YouTube. I'll highlight that the next Food Thinkers will be on the 9th of May with Cynthia Rosenwig. But also again, please do look out for the City Food Symposium on the 27th of April 2023. And please do subscribe to our monthly newsletter, which hopefully is going in the chat now for your last chance there. Again, Christina, thank you so much for presenting tonight at March's Food Thinkers.
Thank you. Bye-bye.
Okay. Goodbye. Be safe, be well, everybody. See you again in May.